Away from the courts, Ghana's COVID-19 situation is getting worse as the new variant of the virus, which is more deadly, spreads fast and becoming the dominant strain within the community. Now, in the latest update by the Ghana Health Service, the country recorded 772 new cases, bringing active cases to 5,515, with 8 new deaths, pushing fatalities to 444 as of January 30. This trend, according to the Minister Designate for Information, Nkrumah, may get the already overstretched health facilities inundated. Now, he is therefore asking that we comply with the steps across the, across as government launches frantic efforts to get a grip on the virus.
Yes, because it comes with the science of it, the clinical trials will tell you exactly what you can do, how safe it is, and so I don't think it is. We should worry about that. If we trust it, let us use it.
Those will cover it. So there's a second batch of questions. Now is a good time to take it. And while I wait for the second batch of questions, just a couple of comments. Now, because there is the very high possibility that as the UK variant becomes widespread, or a lot more widespread, it could overtake the traditional variant. And we're noticing that it has a higher rate of spread. And it appears to be associated with a higher disease burden. It means that instead of lowering our guard or thinking that, we figured this thing out, all of us actually now have to step up our guard. Because what is now around and creeping around is a bit more dire than the first one. So if your compliance level was at 5, when the manageable version was around, now that what appears to be a more dire version is around, I honestly do think they have to step up your compliance level beyond the 5 and not drop it. So we are pleased to see that the wearing of masks is gone up, but we think we are not there yet. A lot more compliance needs to be urged so that we get the results.
And my colleague Manuel Cranton joins us live with more from that news conference. Manuel, we know that there are some health workers who are threatening to lay down their tools over the compensation for frontline health workers. Was there a response on that at that news conference?
Indeed, Ernest, there was a response to that particular call. You remember that sometime last week we had some workers at the Nkrumah Teaching Hospital, and they were claiming that their insurance packages were not being given to them. And indeed, they mentioned again that some people who were not even considered frontline health workers, people who were not considered frontline health workers were benefiting from the insurance packages. And so that concern was brought to bear at the press conference. And Dr. Nkrumah's response was that, indeed, the issue is not lost on the Ghana Health Service. They actually work with a list of frontline health workers, the list which is updated every month. And so people are not, as it were, by default, entitled to the packages as have been, allocated to them. But you need to have been on duty in the month under review to be able to get the package. And that's what he said. But again, he said there's a systematic process that they were in the process of releasing to all those who deserved and were yet to receive their packages. Ernest.
There was also the indication that spread in workplaces is actually on the rise. What exactly was the explanation given? But Manuel, before you give me a response to that, I want us to listen to Dr. Nkrumah explain the issue of the compensation and remuneration allowances to frontline health workers.
Of the compensation. We had defined who a frontline health worker was. The president had given a tax rebate that was up to December last year. And we had frontline workers. The frontline worker data is generated on a monthly basis based on who was on duty, who at the month was frontline worker. A lot of people have been paid. We still have some people who have a few challenge with account numbers and so on. And there's a lot of work going on to make sure that they are all paid. And so yes, we know that there are people who have not been paid, and there are specific reasons why, and they are all being assured that the payment is currently being done, so that they will be paid very soon.
So now let's talk about the issue of spread in workplaces. What was the explanation, Manuel?
Indeed, Ernest, there was an explanation about the number of active cases. In fact, the fresh cases that we are recording, majority of those cases are coming from our offices. And you remember that in the president's 23rd address to the nation, he emphasized that offices and other corporate organizations should, as a matter of urgency, consider rolling out a shift system to be able to allow for a sort of decongestion of the various offices as government works at stemming the tide within the fight against the COVID-19 pandemic. So that was it. But even more importantly, also is a survey that was conducted by the Ghana Health Service over the course of last week, which established that some 42% of people in the Greater Accra region are actually abiding by the safety protocol of wearing the face mask. And the last of the these surveys, which was conducted in 2020, was done actually in October 2020, and at the time just 10% of the people who were surveyed were complying and were adhering to the wearing of the face mask. This time around, you're doing some 42% of the people who were surveyed complying by the directive and the protocol of face mask wearing, and so 42% wearing their masks correctly, and then some 36% wearing the masks but not wearing the masks correctly. So you'd have had some of them wearing on their chin, and so on and so forth. But some 22% of the people who were sampled were not wearing their masks at all, and that gave the need for the Ghana Health Service to caution and emphasize that people must stick to the protocol of wearing the face mask. In its entirety, some 78% of people who were sampled in the Greater Accra region, according to the Ghana Health Service, give an indication of an intention to wear the mask, whether they were wearing the mask correctly or not wearing the mask correctly, Ernest.
Thank you very much, Manuel Quentin, for bringing us details from that news conference organized at the Information Ministry together with the Ghana Health Service.